gave their last full measure of devotion to their country. And I'm announcing today that this Memorial Day service will not go forward at the end of May because of our COVID-19 pandemic. We may be through it by then, but we don't know for sure. It takes a lot of time to plan this. But the point here is that while we're fighting this pandemic, and we think about those who gave their last full measure of devotion fighting for their country from World War II on, we want to remind ourselves about those first responders, those in the medical profession, doctors, nurses, EMTs, everyone in the medical profession who's putting their life on the line for all of us in fighting this pandemic. And for our first responders, the Honolulu Fire Department, Honolulu Police Department, Emergency Services Department, our ocean safety, they're out there every day during this pandemic, putting their health at risk to protect the rest of us, almost 1 million strong, of the city and county of Honolulu. And that's why I'm asking again for everyone who lives on this island to please follow all the orders. Stay at home, work at home. So many sacrifices are being made. Businesses are suffering worse than probably ever. Let's not make it for naught. Let's follow all these orders. And that's why it's very sad that I have to report today that we've now seen our second death from COVID-19 on the island of Oahu. And our hearts go out to the family who lost their loved one, just like our hearts went out to the family who lost their loved one the other day. And sadly, I think there's going to be more. This is a life and death matter, and we need to make sure we're being careful in everything that we do. So you can see on the slide here, it now shows a total of 275 cases for the state of Hawaii. Oahu alone, 206 of them. 27 new cases just today. 24 on Oahu alone. We saw more yesterday, but still we are seeing a large number of cases. And we think that we're going to continue to see that because of the testing that's ongoing. And there's a delay in the testing, so we're going to see maybe a pickup in the coming days. But if we do the right thing, folks, we could see this spike start to level off. We could flatten that curve, giving our medical profession a chance to be ready and maybe never have to make a hard decision about who lives and who dies because we run out of ICU rooms or ventilators. 72 people have recovered statewide. That's the other thing. It doesn't mean because you get COVID-19 you're going to die. But I can promise you, if you don't take the actions we're requesting, more people will die, and one of them could be your loved one. So that leads to one other point I want to make regarding this war that we're at. You know, we have a call center set up, 768 City. We're getting more and more calls now about people complaining about businesses that are open that are not essential and should be closed. We're asking people again, this is life and death. You can call this number, but now if the city gets a call and they say someone is open that shouldn't be open, our call center will call them and explain to them that you're not supposed to be open. And if they persist and say, we're going to disregard the order, we will call our Honolulu Police Department and ask them to go to that business and ask them to comply. I don't think any business wants to have one of our Honolulu's finest men and women in blue walk in and tell them, you're endangering people. So hopefully that's not going to happen. But we see the calls increasing in terms of that. Again, 768 City is a number to call to get answers on all kinds of questions. The next point I want to make is the issue of masks. As the mayor of the city and county of Honolulu, we're asking all residents on this island, when you go outside, whether it's to shop, to jog, whatever it is you do, that you wear a mask. Now, we're not asking you to go wear a N95 mask or a surgical mask. In fact, we're saying don't use those masks. Those are to protect our medical professionals and our first responders. And there's a shortage, and we need to make sure there's sufficient numbers for firefighters and everyone else who's being called to help people who may be sick. What we're asking you to do is wear a cloth mask that could be homemade, that could be purchased by someone. I understand Sig Zane is now making these masks, my favorite Aloha shirt maker. But the point is to wear a mask. It doesn't give you 100% protection, but it does protect you in two ways. Many folks, not many, but there are folks who are asymptomatic. You have COVID-19, but you don't even know it. And you could be contagious. And when you cough or breathe on someone, you could transmit the virus. So the mask protects that person that you're around. But it also protects you too. For me, people criticize and say, Mayor, I saw you on TV, touch your face. Well, with the mask, it's gonna make sure my hand doesn't go in my mouth, and that's important too. So again, it's a recommendation, a very, very strong recommendation, that everyone on this island, when you go out in public, please wear a mask that you've either acquired or made that's not an N95 mask or a surgical mask. Now I would like to ask Dara O'Carroll to come up. Good local name, O'Carroll. He's an ER doc from Kuakini, just up the street from here, to emphasize more and say a few more words. Thank you. Doc, come on up.
Hey guys. Thank you, Mayor Caldwell. Thank you, everybody, for being here. Forgive my appearance. I'm just going to wash my hands a little bit, too, as we do this. I'm going to work right after this, but everything is sterile, I assure everybody here in this room. And I'm wearing a surgical mask just because I'm around the virus more than the average person. And that's to protect everybody in this room. First off, thank you, everybody, not just in this room, but across the islands for everything you're doing. I'm even going a little bit zany being stuck at home, even though I get to work and socialize with not only my patients, but my fellow coworkers. We're all in this together. Right? And my heart goes out to everyone who's already suffered from this, not just in the islands, but worldwide. The first responders, my fellow policemen here, paramedics, all the way down from our registration clerks, our nurses, our registration techs, our ER techs, our radiology techs, everybody in the healthcare community. My heart goes out to everyone. Before I get into talking a little bit more about masks, I'd like to introduce a concept that was taught to me by the Polynesian Voyaging Society. I was lucky enough to be selected as a volunteer on the last leg of Hikianalia back from San Diego to here. And that is He Va'a He Moku, He Moku He Va'a. And that's a canoe is an island, and an island is a canoe. And it's really a testament that when we're voyaging, we are a traveling community. We're a floating island going throughout the Pacific. Everybody looks out for each other, and it starts with our watch parties, which are usually in groups of 4, and it comes down from our watch captain. So what we're doing is we're keeping an eye out on the horizon for ships. We're watching the sails and equipment. We're watching ropes, and we're watching for rogue waves. So if we saw a rope untied, we'd tie it. When dishes had to be done, nobody likes doing dishes, especially when it's rocky out there and it's cold and you're wearing full gear, they were done. Nobody liked to, scrub the toilets, but it was done. And because why? It was good for all of us. It was everything for the safety of the whole crew was paramount and first. So you can take that same concept and value and apply it, one, to your family, your watch crew. And then you can expand it to your family unit, your friend circle, then your neighborhood, then your city, then our islands, then we can go nationally and then globally. We're all in this together. And so what we in the health sector, as your watch captains in this fight, are seeing a rogue wave approaching. And unfortunately, medicine and health is not an exact science like math. I wish we had equations that were saying, yes, this is right, or yes, this is no. But it's a science of probabilities. And so what we're dealing with now is the best evidence and the best probabilities that we have in a real-time fluid situation. And it's really a testament to the medical community that we have this much data this quickly. And so what we already know is that 80 to 85% of this disease is transferred by fomites. I just want to introduce that word, which is an inanimate object, could be this lectern, microphone, anything you touch, that you had the virus that can get on that fomite. And then when you touch that, you can touch your face. And the most high-risk areas are the T-zone, between the eyes, down the mouth, and you can infect yourself. And so we already know that before COVID-19 patients become symptomatic, up to almost 3 days, they can be shedding this virus, creating fomites around the community. And so even if they're touching their face and then touching something else, or even if they're not coughing, they could be spreading this virus. Well, what's coming to light now, and what we may be hearing more, and the CDC, the WHO, are big regulatory bodies that need to make massive, massive decisions. that are a little bit slower to act is that up to 20% of people will never ever exhibit any symptoms, up to 20%. And they'll be unknowingly shedding particles as they walk throughout our communities. So that's everyone, young, old, but predominantly our young patients are going to be the asymptomatic patients, so the 20, 30, 40-year-old population here. So if we were to apply this heva'a, hemoku, heva'a concept to the situation, this is where we come up with masks. And so what's good for me, for you, is to be wearing a mask and prevent those fomites from being spread throughout our communities. So in that light, that's why we're recommending masks. I'm wearing a surgical mask here because this is one I used about a week ago that has now been sterilized. But with regards to how many masks, surgical masks and N95 masks that we have throughout our state, we need to keep those for our healthcare workers and us who are being your watch captains and seeing this high viral load on a regular basis. And so a couple notes on how to sterilize, let's say, like a cloth mask. What's important when you put a mask on is that definitely you wash your hands first, which I did before I touched this. And then you just do one motion. You put it on over your ear loops, make sure it's suggested, and then done. I'm going to take it off because you probably can't hear me anymore. Okay? Taking it off, you just touch it once, wash your hands first, and then take it off. Okay? How we sterilize these things, these cloth masks, is 3 different methods. Definitely soap. Okay? So soap, as you wash your hands, soap is going to kill this virus. So soap, you can think of this virus as encapsulated in a kind of fatty bilayer, and the soap just explodes it. So lots of soap. Hot water, if you can wash this in 160 degrees Fahrenheit, that'd be great. A hot dryer as well. And then if you don't have a dryer at home, hanging this outside in the UV sunlight, the UV light will actually help to sterilize this. So one thing that I actually have to talk about as well is that this is not a cure-all. It's not going to flatten this curve and take it all the way down, but it's going to help to flatten the curve. So it's not meant to give you a false sense of security, that if you're wearing a mask, now I can go and talk to my friends, now we can socialize. So that's probably the last thing you should take out of this recommendation. So in summary, if we all take heva'a, himoku, himoko, heva'a, what's good for everyone, it'll really do a lot to take our curve much, much flatter than not. So this one was given to Dr. Mayo Caldwell by Zig Zane.
Thank you. Now, I don't know if I should even take it from your hands, but
no. We'll sterilize it with some gel, and then you can have it.
Thank you so much. I really appreciate it.
Yeah.
You know, at this point, we'll open up the questions on masks, and I thought this is a good chance to hear from the doctor. If there's questions out there from media. If there's something about my recommendation, I'll answer that too, but he can probably just answer that even on my recommendation.
Absolutely.
So I'll turn it over to the doctor. He has until maybe 5-10 minutes, and then he has to get up to Kuakini to start doing his ER work. Thank you. I'm just waiting to see. Sometimes it takes a while. Other questions that come in.
And I'm just stepping in for just a second as we wait for our reporters are going to be asking questions digitally, and see if any of those questions come in. We'll wait just another minute, and then, of course, after we take these questions from the doctor, the mayor will be continuing his remarks, and then we will also be hearing from Fire Chief Neves, and then, of course, the mayor will be giving concluding remarks when we'll also wait for questions just before his concluding remarks. And do we have any questions coming in for the doctor? All right. Doctor?
Oh, we do have one.
Okay.
We like questions.
From Gordon Pang at the Star Advertiser. Doctor, do you have enough masks, vents, and other equipment?
Yes, at the moment we do. I can't speak hospital or statewide, but at the moment we do. We'd always love to have more, especially of the N95s. So all of you out there, the N95s are really at high risk, used for high risk procedures like the aerosolization procedures when we put people on ventilators. And so if anybody wants to donate any towards your hospital systems, that would be terrific, because those N95s are really overkill for walking out in the public and day to day. So with regards to ventilators, right now, I think Lieutenant Governor Green is definitely shoring up our supplies. I can't comment on any movement on that. I do think we need a few more, but I'd leave it up to Lieutenant Governor Green to answer that question.
Also for the doctor, Ben Gutierrez from Hawaii News Now. How often should masks be washed again?
Oh, yeah. So they should be washed. I apologize if I didn't mention that in the beginning. They should be washed daily, sterilized daily. You should have a couple in your armamentarium, so 3 to 4. So by the time it is dried thoroughly, that first one that you used is now ready to be used.
Great. Okay. Doctor, you want to grab your other mask there?
Absolutely.
To go to waste.
Yes.
Yeah.
And
You can leave that one. Okay.
make sure you wash it.
Yeah, I will. I give you a hug, but I can't. But
I know.
thank you so much.
Shock is 100%
Yeah, shock
safe.
up. Shock up. Yeah, thank you. Hi. So I do want to thank Dr. Dara O'Carroll for his taking the time out from his important job that he has to come down to Honolulu. And, you know, we may be looking forward to having you come back again to talk about masks and other initiatives you may take with different groups that you're working with. So for now, thank you so much and mahalo. Next, I do want to talk about a letter that Mayor Kawakami, Mayor Victorino, and I sent to President Trump yesterday, asking him to please prevent visitors from coming to the state of Hawaii, particularly our 3 counties. We're not asking for flights to be stopped. We need flights to continue to come here. We need to make sure that our returning residents have flights to come home on. We want to make sure that those in the military who are on the front lines have a place to come here to the island of Oahu and other islands, Kauai in particular, to do what they need to do. We want to make sure that there's belly cargo for the things that we need that come in on our planes. Flights are extremely critical. But we don't need to have right now our visitors coming here. You know, and Governor Ige, through his, I believe, extraordinary first-of-the-kind 14-day quarantine for all visitors coming to the state of Hawaii, has made a huge difference. It's really tamped down the number of visitors. When you think about it, March a year ago, 30,000 visitors coming in any given day. Today, it's in the hundreds. But even in the hundreds, it's too much. We have folks coming in that are putting a burden on people who need to do their jobs. Sometimes they're homeless folks who don't have a place to stay and they have to be quarantined in place on shelters that are already stressed and have to have greater social distancing. Or visitors who come expecting to stay in a hotel and find they're closed, and it falls on us to find a place for them. We don't need this right now. And they come in and they could have the pandemic. I mean, they could have COVID-19. So we're asking the president to take action. And because we're such a unique state, everyone has to come here by air, unless you're coming on a ship, and no cruise ships are coming by anymore, that we prohibit visitors only from coming into the state of Hawaii. We issued the letter. We got a call from the White House this morning saying they noticed it. They want to take it to the next step, but they've asked that Governor Ige also weigh in, because this is something that they said they can only respond to if the governor of the state who's requesting it makes that request. And we're hoping he will. We're very grateful for what he's done. His 14-day quarantine I mentioned has made a huge difference. We'd have many more visitors on our shores today, but for the action he has taken. We just want to take it one more step and eliminate and get down to 0 in terms of the number of visitors, at least through April 30th. If we can knock this down, if we can not stress limited resources, I think we could see the curve being bent and even flattened. So one more step in that direction is what we're asking. I wanted to talk next about testing. You know, for me, we are at war, and we need to know where the enemy is. And if it's a war in terms of a physical war, you'd send scouts out to find out where the enemy is and report back, and then you know what to do. This enemy is invisible, but we know it's out there. And the way we figure it out is by testing. Aggressive, ongoing, continuous testing. And in communities where we see testing being done, whether it be in South Korea, whether we be seeing it in Germany, it makes a huge difference. And we see the curve is either flattened or there's not a peak. And so the City and County of Honolulu is going to continue to look for partners to do testing. And we're having this ongoing testing that we started 2 weeks ago, first at Kaka'ako Waterfront Park, and we expanded it to Waipio Peninsula Soccer Complex. So this coming Saturday, April 4th, from 8 till noon, we'll be out at Waipio Peninsula Soccer Complex. Dr. Scott Miskovich will be out there doing his testing. We're providing the platform for that to happen. And then on Sunday, April 5th, we're going to be back at Kaka'ako Waterfront Park from 8 to noon. So Saturday, Waipio Peninsula Soccer Complex from 8 to noon. Sunday, Kaka'ako Waterfront Park from 8 to noon. Now there's conditions. When you show up, they're going to go through a protocol to see if you should be tested or not, because tests are limited and not everyone is getting one. But those who check the boxes will get tested. And then there's a commitment, an agreement that should you be tested, you commit to being quarantined for 14 days in your place of residence or less when you get your result. If it shows negative, you can go back out and do your business, now with a mask on. Or if you're found to be positive, then you need to quarantine for an additional 14 days. So we're hoping people will show up for this test. It's free. It's a way to get information. That information is provided to the Department of Health, and it reports in their statistics, and we know where the enemy is. We know if there's clusters in certain parts of this island, and we can then focus more attention to those parts of the island. And I think it's good information for all of us to know what is happening around us and where that enemy is. Next thing I want to talk about is online auto sales. You know, in our order to stay at home and work at home, we have prohibited all auto sales on the island of Oahu. And we've been hearing from the public, we've been hearing from the Hawaii Auto Dealers Association, and we heard from council members when we met with them earlier this week, that it is having an impact in a limited area that we need to address. And those are folks who have essential jobs or essential businesses that need a vehicle to get around. And their vehicle has either been totaled in an accident or it's beyond repair. It's going to cost more to fix it up than to buy a new vehicle or a used vehicle. And we want to make sure that those that have these essential jobs, that need to do their essential functions, have a way to get around town. And yes, they could ride the bus, but the bus is on a limited holiday schedule. And being in a vehicle by yourself is probably some of the best social distancing you can do. So we want to allow this to occur, and so we're going to be amending my order that mandated that many businesses have to close through our stay-at-home and work-at-home order, which was issued on March 22nd of 2020. So this order is going to apply to only online sales and leasing for either new or used vehicles or trucks. And one, it can be done to close a pending transaction before our directive. So if you're in the process of closing a transaction and the directive came in, you can now finalize it and complete that transaction. Or you need to replace a total damaged vehicle, or your lease is expiring and you need to get a new lease to have a vehicle. As I mentioned, it's only for essential workers and essential businesses. And the buyer must certify that they're in such an activity or business. There's going to be no test driving. You do it online, and ideally the vehicle would be delivered to your home or place of business, and maximum social distancing would be practiced. And with that, you can proceed with purchasing a new or used vehicle. And that order I'll be signing today to make it effective starting tomorrow at 4:30. I wanted to talk about prisoners. We talked about that earlier this week with Chief Ballard, the chief of the Honolulu Police Department. I today sent a letter to Chief Justice Mark Rechtenwald, who's been tasked with how do we deal with overcrowding in our prisons. And there's no doubt that our prisons are overcrowded. It's been like that for decades. And there needs to be prison reform. There needs to be fewer people in the prisons. They shouldn't be overcrowded. And it's a challenge that needs to be addressed. But we remain concerned. We remain concerned about the impacts that it has on the community if prisoners are released. And so we requested that Chief Rechtenwald step back a bit and work with the first responders, the police departments of all our counties to get input from them. We know that the prosecuting attorneys from each of the islands are meeting with the public defenders who came up with the list of who should be released. But our request, our request is that each of the chiefs of police from each of our islands, also be invited into this conversation, because it's to the police departments that the burden falls should any of these released prisoners become repeat offenders. And their resources are stretched. We see that, there's a couple of cases in the Honolulu Police Department of COVID-19. We want to make sure that that is controlled and not allowed to expand. They're dealing with the issues of people not complying with the order to stay at home and work at home. We don't want them to have to now deal with issues for folks who are released, who don't have a place to live, who don't have proper counseling, who don't have a job and no income. This creates problems, and so we want to make sure this is thought through completely. And I think you need to hear from the folks on the front line, and those are men and women in blue, about the impacts it's going to have on them and our broader community who are at home, concerned, worried, scared, and many businesses who are shuttered. And those owners are concerned that their businesses will be protected. Before I go on, I'd like to invite Chief Nevis, the Chief of the Honolulu Fire Department, to come up to say a few words. Thank you, Chief.
Aloha, everybody. I'm Emmanuel Nevis. I'm the Fire Chief of the Honolulu Fire Department. We're facing one of the biggest challenges we've ever faced as a fire department and as a community. These are uncharted waters that require all of us to constantly analyze and adapt to a very dynamic situation. I want to stand here before you today to affirm that the Honolulu Fire Department is committed to ensure the safety of all of our personnel so we can continue to provide the level of service that our community deserves. Before I go any further and take questions, I wanted to send out our thoughts and prayers to our 2 firefighters that have positive results of their COVID-19 test. So we hope them a speedy recovery and a safety for their families. But I'll take any questions that you may have.
Gordon Tang again from the Star Advertiser asks, how many Honolulu firefighters have been tested?
Right now, we don't have an exact count because besides the formal way of getting tested, there are also others that have gone to those sites where you can drive up and take a test. So right now we're about a dozen folks, but we have only 2 positive out of all the tests that have been taken.
And how are you cleaning all 40-plus stations where they live 24/7?
Yeah, what we've been doing is we have standard operating guidelines for disinfecting and desanitizing our stations, and we've been following that. But just recently, in fact, just in the last day, we got the 5 units that provide this electrostatic method of cleaning the fire stations and the fire trucks. So yesterday we had training and we deployed the units. We have 5 units to 1 fire station, and we ended up doing 3. Today we're gonna go through the entire department. All 43 stations and work sites will be sanitized using this equipment.
Do you currently have an HFD quarantine site?
No, we don't.
And do you have enough PPE?
We have enough PPE with the current rate of use. If the use explodes to an unbelievable amount, then we may not have. But we have enough for several months, and we have orders that are pending right now.
And for the firefighter that did test positive, the first one, I guess initially it was said that he didn't come to work. How are the firefighters getting sick if he did not come to work?
I can ask Dr. Omori, who is our infectious disease officer. She interviews all the firefighters, so the decisions on whether or not the firefighter continues to go to work and the folks they work with continue to report to work or self-quarantine at home, those decisions are made with our medical professional, and she does a thorough interview of all the people involved.
You want to have Dr. Omori?
Doctor, you want to step up with me? Because I think we're going to go back and forth with this.
It's great to have another doctor in the house.
So I think the question was, how are the other firefighters getting sick? Well, so there's only, just to be clear, there's only 1 other firefighter that tested positive. As we know, in the past few days, we have had more and more information about asymptomatic people being able to transmit the virus. And so it's thought that even though the first firefighter went to work when he was asymptomatic, that was probably within 24 to 48 hours before he started becoming symptomatic. And so it was enough time for them to have exposure to the other firefighters in that same unit. And because of the nature of how the fire stations are, it's a very close quarters, and basically they all live together, and it's very easy to, even though they're trying to do social distancing there, it's very hard for them to do it in their work environment.
And in regards to those 2 firefighters that tested positive, why haven't all the firefighters in that station where those 2 tested positive been tested?
So right now we are only testing symptomatic people, and that's the general guidance for everybody right now. And just because you're exposed to somebody, and even if you are going to at some point become positive, we don't test during the asymptomatic period because the viral load is not high enough to detect it. And so even if you get a negative test, it's like a false sense of security, because that doesn't necessarily mean that they're negative, and that's not really going to change the course of anything. All of those firefighters that have been exposed to those 2 positives have been taken off work, and they will be staying home for 14 days from the last point of contact.
Casey Harlow from Hawaii Public Radio. A previous release said the first firefighter confirmed to have COVID-19 at Kalihiuka recently traveled and had no contact with the station. Do you have an idea on how that second firefighter at the station contracted it?
So the first firefighter did go to work after he returned from his vacation, and so he was working, and so there was exposure to the other firefighters. It's just he didn't come to work when he started to have symptoms, but he was there the few days prior to that.
This is for Chief from James at KITV. When a firefighter tests positive and his or her station is closed like we've seen, how does that impact response times?
We don't like to close fire stations, but the way we respond, we have to protect 610 square miles of the island of Oahu and protecting about 1 million people. So it's a dynamic response. Even though one company may be out fighting a fire or out drilling or exercising, we have a dynamic coverage. So we constantly move resources around, and we use global positioning satellites. We use computer software to give us the best scenario as to how do we cover the remaining folks that are out there. So we have a process that's very dynamic.
And Ben, again from Hawaii News Now, why wasn't Station 32 closed for heavy cleaning immediately after that first firefighter tested positive?
We didn't. We have, like I said, we had our standard operating guidelines using a bleach solution, and the station did that. But as of yesterday, we got the new device that's in, so we have a better ability to clean the stations. But the stations were cleaned to the best of our ability at that time.
And have any extra steps been taken to clean the home stations of other firefighters who filled in at Station 32?
Yes, like I said, we're in the process of sanitizing our entire department, all of our facilities, and then hopefully the remaining order will come in of those devices, and we can have one of those devices at every fire station. So whenever they feel a need to disinfect their fire truck or their station, they'll have the ability with the unit there.
And several media stations asking the same question on why the press release said that first firefighter did not return to work.
I don't know why they would say that.
And is it true that the one who tested positive showed up at the station, cooked food for his fellow firefighters before falling sick and going home?
I don't have that information.
And from KHON, how much is it going to cost to man Station 32 with other firefighters and the overtime that they're working?
I don't have the exact figures, but we stand up about 350 firefighters every single day, every morning. That's the number of positions that we have. So When we cover our stations, we have a band. So from 100% every single position filled, that's the 350 folks, down to the minimum staffing. So there's a gap, a huge gap. So we're not at the point where we're reaching the bottom end of that gap where we have a shortage of firefighters. So right now, our operations are pretty much at the normal rate. So the overtime that's being expended at Station 32 is just part of a normal operations that we have.
This might be for the doctor since we still have her here. Some are asking about elevator etiquette, especially with elevators in high-rise condos and the high density of residents that those high-rises have.
In terms of how they should behave. So
Yeah.
as much as possible, you should stay at least 6 feet apart if you can. And I know that some elevators are much smaller, but I think that goes back to the point that the mayor was saying and Dr. O'Carroll was talking about wearing masks. And so that's probably the best way you can protect yourself and other people right now. So anytime you go out, and there's always going to be times when you can't socially distance yourself, maybe the whole 6 feet. And so having masks on is probably going to be the best way.
All right, thank you all. Now we'll have some closing comments from Mayor Caldwell, and then we will open it up again to questions. So if reporters would like to submit their questions for Mayor Caldwell at this time.
So I want to again thank everyone for tuning in. And, you know, we heard from two MDs today, medical doctors. We've heard from a first responder, the chief of our firefighters. These are the people on the front line on the island of Oahu, putting their health and safety at risk to protect all of us. And we need to remember that as we do everything that we do on this island. So today we talked about masks and the recommendation, the strong recommendation that everyone wear a mask when they go out. For me, I think it's simple as this. You should assume you have COVID-19, and you should assume everyone around you has COVID-19. So when you put on the mask, you're protecting others from maybe getting something you may have. And you're also protecting yourself from COVID-19 from someone else. And if we do this, I believe we begin to flatten that curve and buy us time so our first responders and our medical doctors have time to be ready and hopefully never hit that point where you run out of intensive care unit rooms because we flatten that curve. It's incumbent on all of us. And that's why I just want to emphasize, we need testing, and it needs to be done continually, it needs to be active, it needs to be pragmatic, and it has to be a targeted approach, and we're doing that. 2, another way to flatten the curve is quarantine. Quarantine, stay at home, work at home. Don't go out unless you absolutely have to. And finally, social distancing. Again, practice it everywhere you go. I'd add in the elevator. Here at the city and county, we have small elevators. If it's too crowded, we wait to the next one. Someone steps out. I've seen that in other places around town too. Be considerate of each other, wear your mask out in public, but if it's too crowded, wait for the next one. It's that important to just take that extra time. And finally, I want to just emphasize that while you're at home or while you're at work and you're practicing good social distancing, if you have questions, any questions, call 768-CITY. Someone will pick up. An active person who will answer your question, try to get you an answer, or refer you to the proper place. I want to emphasize again, we are at war. We can win this war. With time, we can see a flattening of that curve, and that is dependent on all of us doing what we've been asking all of you to do. With that, open up to any questions you have, and if the doc could wait around, and Chief Nevis, in case there's additional questions asked.
From Hawaii News Now, why didn't Mayor Harry Kim join in the letter to the White House?
You know, I don't know. You're going to have to ask Mayor Kim. You know, each of us sees our island from the positions that we stand on. I would never second guess a mayor of another island, but having grown up in Hilo, you know, that island is so different than any other place. You can fit the entire island of Oahu in the district of Puna and still have space left over. So he has his reasons, and I wouldn't second guess those reasons.
From Casey Harlow again. What kinds of non-essential businesses are you getting complaints about?
We've gotten some on car dealerships. We've heard people doing ads on KSSK saying we're open for business. Come on down. We've cleaned our showroom, and the banks are making loans. That is not supposed to happen, and we're following up on those types of businesses.
KITV just asking for you to repeat again. You touched on this earlier, the White House receiving that letter from the mayors about shutting down non-essential travel. If you could just repeat that update.
Yeah. So a letter was sent yesterday signed by 3 mayors, Mayor Kawakami, Mayor Victorino, and myself, asking the President of the United States to prevent visitors from coming to the state of Hawaii until April 30th so that we have time to flatten the curve. We heard from the White House this morning, and they have said they would consider it, but it needs to be a request made by the governor of the state, whatever state it is. In our case, the governor of the state of Hawaii. And we've transmitted that request on to the governor.
And let's see. Hawaii News Now is asking, we're telling people to wear masks after the Surgeon General said a few weeks ago to stop buying masks. I know the science keeps changing, but perhaps the public needs clearer guidance.
So, you know, again, the emphasis here today is that we're strongly recommending everyone wear masks, but to make the masks. We do know that there are people who are gathering and sewing masks, practicing good social distancing. We've been approached to see if places in Blaisdell could be used because there's a lot of space. And you see an example of Sig Zane making masks. So we're not asking people to go out and try to find N95 masks or surgical masks that really should be available just to our medical professionals and to our first responders. And I know that even the CDC now is changing, the White House is changing their recommendation on masks. We know other mayors are doing so too. I think one thing we could all do is go see how Mayor Kawakami makes a mask out of a T-shirt. I've not seen it myself, but they say you can go online, and if someone can tell me what that is, where you go, you can see how one very industrious mayor has been able to protect himself.
His Facebook page.
Oh, it's Derek Kawakami's Facebook page, however you find that.
And to go along with that, just with masks being so hard to get, is the city going to coordinate distribution of any type?
At this point, not, but it's something we're exploring and looking into, and you know, perhaps we'll have more announcements on that next week. Okay, you want to conclude, Alex? Come on up and conclude.
All right. Thank you, everyone. Thank you, everyone watching at home. And thank you also to our reporters who are asking questions digitally. Thank you to Dara O'Carroll, Dr. Dara O'Carroll, of course, our representatives from the fire department as well. We'll be doing our best to hold these media briefings on Tuesdays and Thursdays at 1 p.m. throughout the month of April. And thank you all for joining.